do you remember that elderly gentleman we saw a few months back? He had come to us with a wound in his foot, which he thought was a trivial shoe bite. But then subsequently, when his foot started worsening and the foot started turning black, he came to us. And then when we did the scan...
Yes, I remember. He was a classical case of peripheral arterial disease. When he came to us, nearly 80% of his arteries were blocked. A small ulcer nearly cost him his limb.
Exactly. And sadly, Pavan, this is not an exception that we had. It has almost become a norm. For us in India, peripheral vascular disease patients are often coming at a very late stage. Most of the people do not know that vascular surgeons even exist.
Yes, this is exactly the problem we face. So most of the people don't know the existence of vascular disease and they assume that it has to do with the heart. But peripheral arterial disease affects the limbs and mostly the legs.
And what worries me, Pavan, is that it all starts so quietly. They initially have some pain in their calf muscles when they are walking, a little bit of numbness of their toes or coldness of their toes, a small wound which doesn't heal for a long time, and all these problems get brushed off quite easily. And more so in our diabetic patients where they cannot feel these pain and due to their neuropathy, it often gets ignored.
Especially with India, being a country with such a high burden of diabetes, we are the second largest country with diabetes. So it comes with its own set of complications if neglected, like amputations, infection, which lead to disabilities.
And now what is worrying is we are seeing these in younger patients too. People in their 40s, smokers, uncontrolled diabetes. We are seeing all these set of population developing, narrowing in their arteries at much earlier age.
One of the most powerful stories I came across was that of a daily wage worker who had leg pain for almost 6 months and attributed that to overwork. But by the time he reached us, his limb couldn't be saved. What was his mistake? Not reaching out to us earlier.
Which is the exact reason why awareness is critical. With minimally invasive procedures or with simple Doppler scans which are non-invasive, we can pick up peripheral arterial disease. It is not necessary that most of the patients have to undergo open surgeries. We can even treat them with many minimally invasive procedures.
And the role of vascular surgeon is key here. We are trained not just to open blocked arteries, but also formulate long-term treatment plans for limb salvage. It is not just about treating a wound, it is about restoring independence, mobility and dignity.
I think, Pavan, it is high time we change the narrative. Limb pain is not a normal part of aging, and wounds which do not heal on time are not to be ignored. These problems are not usually skin deep but run deeper down into their arteries.
So if you or someone you know has pain in their legs on walking, has darkened toes or ulcers on the foot which are not healing, don't delay. Seek out a vascular surgeon's opinion immediately. Early intervention can save limbs.
Peripheral arterial disease does not always have to end with amputations. Timely diagnosis, timely treatment, and most importantly, seeking the right specialist can prevent amputation of limbs.
So let's spread the word and share the message. The road to saving a limb often starts with a conversation.